All right. Good morning, everybody. Dr. Rafich here. Sunday, December 1st, 2024, 8:50 a.m. Pacific time. We are almost done with this May 2015 issue of Veterinary Surgery. We are going to be talking about the occurrence of incisional complications after closure of equine celiotomies with USP7 polydioxanone. This comes out of Saskatoon, Canada. Objective to report the occurrence of and risk factors associated with incisional complications of equine ventral midline celiotomies closed with USP7 polydioxanone. Retrospective study, 73 horses with 75 celiotomies. Records were from 2000 to 2010. The ventral celiotomy was closed with 7 polydioxanone, and these horses have to survive at least 14 days postoperatively. And then there was follow-up over 1 year after surgery. Results: one or more incisional complications occurred, giving it a 25.3% incidence during hospitalization or after discharge. These include drainage at 25.3%, infection 12%, partial dehiscence 5.3%. 3.2% of horses available for follow-up developed an incisional hernia. Variables associated with complications include the number of days hospitalized, surgical time, postoperative colic, and postoperative fever. Introduction. The published rates of occurrences of incisional complications range from 16.8% to 80% of horses after initial exploratory celiotomy. That's an insanely wide range, 16.8 to 80%. So it makes the 25% found in the study not that bad considering. Risk factors associated with incisional complications include pyrexia, repeat celiotomy, and duration of surgery. Risk factors associated with development of incisional hernia include incisional drainage, infection, repeat celiotomy. Reduced incisional complications or improved healing have been reported by use of abdominal bandage, triclosan impregnated suture, use of subcutaneous versus no subcutaneous suture, use of suture versus staples to close the skin, different methods of surgical preparation, use of intra and postoperative culture to predict development of complications. In North America, equine celiotomies are commonly closed with 2 or 3 polygalactin 910 or 2 lactamer 9-1 or 2 polydioxanone, whereas a much larger suture, a 1 millimeter diameter braided polydioxanone, is used in the clinic in this study. This suture is mechanically superior, both in breaking and bursting strength compared with other commonly used suture types and sizes. Resisted failure before the equine abdominal wall through the significance. The suture resisted failure before equine abdominal wall, although the significance of this finding is unknown in vivo. Materials and methods. This suture was used in a simple continuous pattern. For cases where repeat celiotomy was performed, celiotomies were considered separately if celiotomy occurred over 4 months after the first celiotomy, or a celiotomy was created in a new location like perimedian. I don't know why they considered 4 months as the cutoff point in this study. Surgeries were performed by multiple surgeons and surgery residents. That's also an issue because surgical technique plays a massive role, and usually surgical residents are going to have higher number of complications versus surgeons. Clipped and aseptically prepped for surgery with 7.5% povidone iodine scrub, rinsed with water, 3 scrub cycles. This was followed by 7.5% povidone iodine solution, rinsed with 70% isopropyl alcohol, 3 scrub cycles. Finally, 10% povidone was applied to the surgical site without removal before draping. Celiotomies were closed in 3 layers: linea alba, ventral median, or external rectus sheath of the rectus abdominis muscle. Perimedian was closed with at least 1 simple continuous section using the suture. 2 subcutaneous tissues with a variety of suture sizes and types: 3.0 to 0 polyglycaparone 25 or 3.0 to 2.0 polydioxanone, and 3 the skin with stainless steel skin staples or 2.0 polyglycaparone 25 in a simple continuous pattern. In most cases, incisions were covered with a transparent adhesive film, an iodine impregnated adhesive drape, or a stent to allow that was removed in 72 hours. Horses were given gentamicin sulfate, 6.6 mg per kg IV once daily, and sodium penicillin, 22,000 units per kilogram IV every 6 hours, or ceftiofur at 2.2 mg per kg intramuscularly once a day for 2 to 5 days postoperatively. Flunixin meglumine, 1.1 mg per kg IV BID, was given for 2 to 3 days, and the dose was tapered over 1 to 5 days. Abdominal bandages consisted of a sterile nonstick cotton dressing against the incision secured with adhesive elastic tape, and they were placed at the discretion of the surgeon. Horses were recommended to return to work no sooner than 90 days post-op. Results. Horses, mostly mares, followed by geldings and stallions. Mean age 9.7 years, mean weight 513 kilograms. Most common breed was quarter horse, then Arabian, then thoroughbred. 86.3% were available for over 1 year follow-up. Now, regarding incisional edema, 85.3% of celiotomies had some peri-incisional edema in the postoperative period. Median date to recognizing this was 2 days. Incisional drainage, 21.3% of celiotomies had some postoperative drainage during hospitalization, and others had it after discharge. So 25.3% of celiotomies had drainage. Types of drainage most often were for equal prevalence, blood, serous, sanguineous, and unknown. The median day to recognize this was 2 days. Incisional infection, 8% had infection based on positive culture. However, if you also added in those horses that had drainage but no positive culture was collected, like no culture was collected at all, and it was actually 12% had incisional infection. Now, just because you have discharge doesn't mean there's infection, but they mentioned here that a previous study lumped in drainage with associating that with infection. That's why they did it this way. The median postoperative day of diagnosing infection was day 10. E. coli was number 1, and then equal contributions by Pseudomonas aeruginosa, Streptococcus zooepidemicus, Klebsiella oxytoca, and a mixed population. Incisional dehiscence occurred in 5.3%, and incisional dehiscence was preceded by infection based on positive culture in all cases. Incisional herniation was 3.2%. Variables associated with incisional complications. These include increased number of days the horse was hospitalized, increased length of surgery, the occurrence of postoperative colic, and developing a fever postoperatively. Okay, discussion. The overall occurrence of incisional complications after exploratory celiotomy was 25.3%. The occurrence of hernia was comparably low at 3.2%. Risk factors identified for incisional complications included the days of hospitalization, length of surgery, postoperative colic, postoperative fever. These have been reported in previous studies. Other studies have identified increased surgical time as a risk factor for the development of postoperative complications. Longer surgeries associated with increased morbidity in horses with exploratory celiotomy. A recent retrospective study also found the number of days to be associated with incisional complications. This association may be because horses with incisional complications were hospitalized longer to more effectively treat the incisional complication, often with an antibiotic or local wound healing, local wound treatment. Horses that are hospitalized longer may be experiencing non-incisional complications that might be associated with the occurrence of incisional complications. Increased number of days of hospitalization and prolonged treatment adds expense and is commonly associated with surgical site infections in people and animals. Other studies have also found postoperative colic to be associated with the occurrence of incisional complications. It is possible that the horse has postoperative colic. They may roll and get up and roll. They may roll, get up and down more frequently, which could potentially add stress to the incision, causing tissue damage, delay healing, and complication. Further, a primary reason for repeat celiotomy is postoperative colic. Repeat celiotomy was identified in a study by others as a risk factor for postoperative incisional complications. Repeat celiotomy may be performed through the original ventral median celiotomy or through a new paramedian, usually to the right of the midline celiotomy. This is unsurprising because many horses develop incisional complications, especially infection, do develop mild to moderate fevers. Other studies evaluating risk factors associated with postoperative incisional complications have also found fever to be associated with the occurrence of incisional complications. The occurrence of drainage during hospitalization and after in our study was 25.3%, compared with other reports of 20 to 38.1%. Of all types of drainage, most began within 1 to 5 days postoperatively. That was 75% of horses, median of 2 days, which is consistent with findings in other studies. Several studies have considered any sort of drainage to indicate infection, whereas others differentiate between infection and drainage. It has been demonstrated in multiple studies that horses that develop an incision infection or drainage are at risk of developing hernia. This suture has demonstrated superior mechanical properties compared with other commonly used sutures that may be used for equine celiotomy. In a bursting strength model, this suture was used in a simple continuous pattern to close equine ventral midline celiotomies. This suture never failed before the abdominal wall did. This was likely because of the high breaking strength. Combined with simple continuous pattern has been shown to resist failure compared with interrupted suture patterns. Based on tissue reaction to suture, the smallest size suture should be used to close a surgical wound with a pattern that results in creation of the least number of knots. It has been shown that in rat celiotomies, closures that the severity of tissue's reaction around a knot is related to the size of the suture rather than the number of throws in the knot used to secure the knot. But the volume of tissue reaction around a knot is related to the size of the suture and number of throws used to secure the knot. In addition, the volume of the knot is dependent on the size of the suture rather than the number of throws placed to secure the knot. So finally, they concluded that this suture should be considered appropriate for closing equine celiotomies. It's a pretty straightforward study. It'd be great to have more horses involved, of course, like always. And there were a couple of other problems that I mentioned with the study, but pretty straightforward. And we've got, it looks like, one more paper in this journal, and then we move on to the next journal. So thanks for those who are watching the playback. We'll see you guys soon. Take care.